So my name is Haley K. Scott, and I'm the Climate Justice Grassroots Organizer for Beyond Toxics and the NAACP Eugene Springfield chapter. And today we are joined by Dr. Lauren Herbert, a pediatrician and pediatric infectious disease specialist who works in Springfield, Oregon. We have invited Lauren to talk about air pollution and COVID-19. And I guess I'll get started with our first question. Dr. Herbert, does air pollution increase the risk of COVID-19?
Well, there are a number of studies that suggest there may be a link. So as the SARS-CoV-2 virus, which is the virus that causes COVID-19, spread through China and then through Italy, it became apparent that the number of cases was highest in the most polluted areas of both China and Italy, and that the mortality rate was higher in those areas as well. So in Italy, for example, 3/4 of the cases occurred in the 4 cities with the known to have the highest pollution rates. So then epidemiologists from both China and Italy studied the relationship between air pollution and COVID-19 hospitalizations and death. And in both countries, the investigators found a strong association between specific pollutants and severe disease and death. However, those investigators didn't adjust for confounding variables such as age, obesity, smoking rates, population density. There's lots of different factors that could explain those differences. So more recently, researchers from Harvard School of Public Health conducted a study of the entire United States. They looked at 3,000 counties, which included 98% of the population, and they looked at the association between death counts and exposure to particle pollution that's called PM 2.5. And this time, the investigators did adjust for their results for multiple confounding factors. And even after making those adjustments, there was an 8% increase in mortality rate from COVID-19 for each increase in 1 microgram per cubic meter of PM 2.5. So their results have been submitted. They're not yet published. And not yet, they haven't gone through that peer review.
Awesome. Yeah, thank you for that. And Lauren, I'm wondering if you can elaborate a little bit more on what PM 2.5 is.
Yeah, so PM 2.5 is an abbreviation for particulate matter, which is 2.5 micrometers in diameter. And that's a term that's used for fine particle air pollution. So these, just to give it a better image, rather, because I don't have in my mind what 2.5 micrometers is. If you think of a human hair, it's 100 times smaller than the diameter of a human hair. And those PM 2.5 particles come from a number of different places, but a lot of them result from combustion of fossil fuel, wood, grass, other organic matter. And these particles are they're small enough that they're able to travel deeply into the airways and lungs. And so they've long been identified as a risk factor for adverse health events, adverse health outcomes. And so past studies have shown that higher levels of this very small particle air pollution are associated with increased respiratory and cardiovascular hospital admissions, ER visits, and death. And it's also been shown that there's increased mortality in those areas that have elevated levels of PM 2.5. There's increased levels of mortality from lung cancer and heart disease. The other thing is that breathing these very small particles has already been shown to be associated with a high risk of severe disease from other respiratory infections such as influenza and SARS. So it's really no surprise that you also see this increased mortality and severe disease with the SARS-CoV-2, the cause of COVID-19.
Okay, so there were more COVID-19 hospitalizations and deaths in areas with higher air pollution, even when the researchers made sure that this was not due to other factors.
Exactly.
But I'm wondering, why would increased air pollution cause more severe disease and more deaths?
Well, There are several possible explanations. Previous studies have shown that air pollution causes cell damage and inflammation, and it suppresses the early immune response to infections. So that's one mechanism. So so you can imagine that that will lead to increased risk of infections from many causes, including SARS-CoV-2. And another factor is, as I mentioned earlier, the PM 2.5 has been associated with increased risk of heart disease and lung disease. And both heart and lung disease have been identified as very high risk factors for severe illness and death from COVID-19. So it may be that there increased death in those regions with high air pollution, because air pollution causes the underlying diseases that lead to higher risk of severe disease with SARS-CoV-2, with infection with that virus. There's also speculation that air pollution leads to increased binding of the virus to receptor cells in the respiratory tract, so that people who are exposed to air pollution could have a higher burden of infection. So more viruses causing more severe disease. The others think that the particulate matter in the air could actually enhance transmission. So SARS-CoV-2 is an RNA virus, not a DNA virus. So when you look for, I think people are pretty familiar with DNA PCR and looking for evidence of viral infections. Well, with SARS-CoV-2, you need to look for the RNA. So they've been able to isolate the RNA using that same PCR reaction from fine particles of air pollution. That doesn't mean that we don't know yet whether there's viable virus being carried by those particles, but it's possible. And since those particles penetrate deeply into the airways and into the very distal alveoli in the lungs, it could be an explanation about why in areas there's such high pollution that people are getting such severe disease.
Okay, yeah. So I guess my next question would be, does the increased mortality associated with air pollution partially explain the higher hospitalizations and deaths in communities of color, especially Latinx and Black communities?
Well, yeah, more Blacks and Latinx are being exposed to air pollution. And so, yes, it could contribute to the increased incidence of severe disease. There are multiple other factors, of course, but this may be yet another factor that is placing communities of color at increased risk.
Okay, thank you. So I guess one last question that I would like to ask is, it seems that decreasing air pollution levels could help decrease severe COVID-19 infections and death. Are there any efforts by governments to strengthen air pollution standards in response to this information?
No, at least not at the federal level. In fact, in March, the EPA relaxed environmental rules in response to the pandemic, so that power and industrial companies could determine for themselves whether they could meet the laws on reporting air and water pollution. So in Oregon, we recently adopted stronger air quality standards based on protecting human health, but the program's in its first year, and we haven't yet seen any measurable changes. So we need our air protection agencies to prioritize human health in their air pollution permits. So, and I just wanted to add, I hope that there will be a vaccine that will be effective and that we can start to control this pandemic. However, I don't think that the vaccine is the entire answer. This pandemic is exposing healthcare inequalities in our country and in the world, which we need to correct. It is also showing how air pollution can interact with pathogens to increase the severity of disease. To control this pandemic and to prevent futures pandemics, we need to have a more comprehensive solutions that consider environmental health.
Okay, well, thank you. I mean, that's a great way to close this interview. And I just want to thank you again for joining us. We really appreciate your time, and I think this information is so important. And so I hope our viewers find this beneficial to their work and moving forward. So thank you again.
You're welcome. Yeah.